Hi everyone, welcome back to Docs Hangout. My name is Dr. Lakshmi Vaswani. I'm a clinical pathologist, a medical writer, and a healthcare communicator. On behalf of Docs Campus, I'm pleased to welcome a very special guest with us today, Dr. Mansi Chowhan. Dr. Chowhan is a renowned surgical oncologist with more than 11 years of experience in breast oncoplasty, head and neck surgery, and reconstructive procedures. Dr. Chowhan, it's indeed a pleasure and an honor to have you with us today.
Thank you so much, Dr. Lakshmi. Thank you, Docs Hangout, for having me here today. And I'm looking forward for a very interactive and interesting session today.
Well, let's get started. Could you please explain to our audience what causes breast cancer?
Yeah, so it's a very intriguing question, though, but unfortunately, I am the medical science. We don't have a direct answer for it. That what is the cause of breast cancer? So, breast cancer, as we all know, it's a very well-known menace, and it has been there for a while, and it's the most common cancer amongst women in India as well as globally. But we don't exactly know what causes breast cancer, but what we know are the risk factors. What we understand by risk factors is by indulging in these practices, or these are the factors which might increase your chances of having breast cancer, might increase the chances of having breast cancer. So these factors can be broadly divided into genetic factors and environment groups, that is genetic and environmental factors. So by genetic factors, what we understand is the genes which we are born with. So 10 to 15% of these breast cancer are hereditary or familial cancers. Rest of all of them, that is the major chunk, is environmental. So the familial or the hereditary part is very small, that is around 15% or something. The environmental factors are factors like what we eat, the type of lifestyle we are living, and the hormonal factors which come into play here. So an early menarche, that is, or a late menopause, so the amount of estrogen exposure in a female's body, that increases the chances of having breast cancer. And a reduced exposure of progesterone hormone in the body is also one of those reasons. So factors like time planning a pregnancy timely and breastfeeding, all these factors prevent breast cancer. And factors like early menarche and late menopause, then stress causing factors, indulgence in alcohol and smoking, all these factors increase estrogen and hence the chances of getting breast cancer. So these are the hormonal factors which come into play here. Also, obesity is one of the risk factors which has been identified and proven now, which is one of the reasons for causing breast cancer.
Correct. And in your daily practice, when you're dealing with so many women, have you seen an increase, a dramatic increase over the years of breast cancer diagnosis?
Yeah, so we are in this scenario, we have a difference in our country as compared to the Western scenario. So yes, definitely there has been an increase in the incidence of breast cancer in India as well as abroad, but partly that is because of increased awareness, increased screening programs, so that more and more cases are diagnosed now. But at the same time, because of the kind of lifestyle we are living, that is also one of the factors which is causing the increase, the environment which has changed around us as well as within the female's body. So that is also one of the reason of increase in the incidences of breast cancer. So approximately every year more than 1.5 lakh females are diagnosed with breast cancer in India itself. So
Correct.
the numbers are really high, and unfortunately they are diagnosed at a later stage. So this is where the difference is there in our country as compared to the Western countries. So in West, the diagnosis lies in stage 1 or 2, that is the early stage, so that the chances of their survival and treatment increases. While in our country, they are diagnosed really late in an advanced or a later stage, that is stage 3 or 4, when it really becomes difficult to control the disease and treat it. So that's where we are lacking behind, and hence all the awareness that is required.
Correct. Speaking of awareness, at what age do you think women should start screening, and what type of screening tests are available if we're interested in doing so?
Yeah. So if we go by the book, then it is 40 years and above. So all the females who are 40 years and above should undergo an annual mammogram, that is like an X-ray of the breast. So that is required for all women more than 40 years of age, and once in a year. Along with that, sometimes an ultrasound is also required depending upon the density of the breast. So for denser breast, a correlation with ultrasound is sometimes required along with the mammography. But at the same time, 40 years is not a cutoff age for breast cancer. So definitely we have been seeing a lot of younger females, especially in our country, getting this disease. In fact, we have been treating patients who are college going girls in 20s who have also been diagnosed with this. So then definitely it's not a 40 years cutoff. For females who are younger than 40 years, they should undergo ultrasound. They can do their self breast examination, and they can do an annual clinical breast examination, that is visiting the doctor and doing a physical examination with them. So this is what is for the females who are less than 40 years of age.
And how would a case of breast cancer be diagnosed? What is the most common presenting factor that comes in your practice?
So most commonly it's a lump, it's breast lump, but there can be other factors as well, like there can be thickening of the skin of the breast or orange like skin of the breast, any change in the contour of the breast, a sudden depression or a bulging or a dimpling, any abnormal nipple discharge, especially a blood discharge from the nipple, any change in the nipple shape and size, if the nipple goes inside, that is inverted nipple. So all these or in fact a lump in the armpit is also a common presentation. So sometimes the breast lump is very small, but the first station from where the cancer goes from breast is to the armpit lymph nodes. Sometimes the lymph nodes are enlarged and you feel a lump in the armpit region while there is no lesion or lump in the breast. But at the same time, it is to be remembered that not all breast lumps are cancerous. So any lump in the breast needs some evaluation. You need to visit the doctor, get it evaluated and sorted out. But most of the time, like 70% of the times, it might be a non-cancerous or a benign lump. It cannot be left like that, but not all breast lumps are cancerous.
Well, we know the cancer is staged, early stage, late stage. So how does that affect the treatment? What are the different types of treatment modalities that go according to that?
Yeah, so therefore, whenever we talk about breast cancer, we always talk about what stage it is. And not just breast cancer, but any cancer anywhere else in the body, it is always staged. So like that, the stages in the breast cancer are 1 to 4. 1 is the early stage, and 4 is when the cancer has spread to other organs of the body, or it is called the metastatic. So broadly speaking, stage 1 or 2 are the early breast cancer, and 3 is locally advanced. So by that what we mean is the cancer has been advanced, but it is still local. It has not reached other organs of the body. And 4 is when it has metastasized or spread to other organs like bones, lungs, liver. So this is how it is categorized. The staging is important from two perspectives. One is to know what treatment is required for that stage, as well as it prognosticates. That is, it tells you how the cancer is going to behave, or it will tell you how the disease is going to behave for that patient. So, what would be the survival rate? So stage 1 and 2, we can achieve higher survival rates like 90% and above. But for the later stages, the survival rates reduces. So this is why we have to stage breast cancer.
Right. I know that most women, when they come, they especially if they're in the childbearing age, they're concerned as to how the treatment of breast cancer can affect their fertility. So does it affect, and in which conditions will it affect fertility?
Yeah. So so this has been a difficult situation in managing breast cancer patients, especially in our country, because we are facing more younger women who are diagnosed with breast cancer. So first of all, before starting the treatment, if the patient should be informed that these are the problems which he might have with the treatment, And if the family is not completed, or if she's planning to preserve the fertility, there are certain things which needs to be done. So during the treatment, there will be chemotherapy might be given to the patient, and these chemotherapy drugs are toxic drugs, and they might affect the fertility of the lady. So before the initiation of the chemotherapy or the hormonal therapy, she should be informed. There can be things like fertility preservation procedures which can be done. The ovum or the egg preservation procedures can be done, and at the same time there are certain injections which can be given to her, which protects the ovary, and so that after the treatment is over, she can conceive a baby. So all of this counseling and all of this discussion has to happen before the initiation of treatment. And because the patient, when they come to us, they are already facing a lot of difficulty thinking about the cancer, already accepting that diagnosis, and thinking about what is the life going to be, whether there will be life or not after being diagnosed with cancer. So this is something which should come from the physician's point of view, that this is something which you should know and should think about before going ahead with the treatment.
Correct, correct. Some very good points there. Thank you. Also, another fear as a lady when you go in and you have a cancer diagnosis, a breast cancer diagnosis, is post-surgery. What will the shape of the body be? Breast reconstruction? What kind of surgeries are available for us? Could you speak a little bit about that?
Yeah. So I am very pro for talking about all these things, because way back, like 50 years back, the only surgery for breast cancer was breast cancer removal. But when you are already removing the breast cancer, I think the fight against the breast cancer, you are losing it half, because you're removing an important part of the women's body. So there are many surgical procedures which are now available, and they have been there for decades altogether, but unfortunately not very commonly practiced, sometimes because of fear of the disease coming back if they are preserving the breast, and sometimes because of lack of the techniques or the surgeon's experience about those techniques. So these are called breast conservation surgeries and breast oncoplastic surgery. So by breast oncoplasty, this is about two words. Onco is resection of the tumor, so that we completely remove the tumor from the breast. But by using plastic surgery techniques, we are able to remodel and reshape the breast so that we can conserve it. But at the same time, when we are removing the whole breast, sometimes the patient, most of the times, patient might not require any further treatment in terms of radiation. But when we are trying to preserve the breast, so radiation therapy is a must after that for the rest of the breast tissue which is left. But this has a very significant impact on the body image of the individual, the emotional well-being of the patient. So maybe during that treatment time, that is around 6 to 8 months, she might not feel the need of or might not think about the body image, because she is probably thinking about more important issues, like there are a lot of financial issues, a lot of issues in the family, social issues, she's losing her hair, and the fertility. So probably not then, but 2 years down the line, it becomes a very important thing that the breast was removed. So all these things, because they are available, the surgical techniques are there, and they are scientifically proven that they are equal to removing the complete breast. So it should be discussed with the patient and should be carried out.
Great. Yes, it is indeed a very important subject to speak about. It's almost taboo in some places. So the more we get women aware about this, the better. Uh, are there any trends in the last few years, treatment-wise, that have shown to improve patient outcomes when it comes to treatment?
Yes, so yeah, very interestingly, because breast cancer is the most common cancer in women, so a lot of studies and research has happened over these years, and fortunately now we understand this disease at a more molecular or a genetic level, and hence we have treatment options available at that level. So initially, when we were talking about the stages of breast cancer, stage 1, 2, 3, 4, more relevant these days are the molecular profile of breast cancer. So there are certain things like the IHC markers that are called the estrogen receptor, progesterone receptor. These are ERPR. Then there is a certain gene called HER2/neu, and there is an index Ki67. This is a proliferative index. So all these four markers help us profile the type of breast cancer and hence guide us through the treatment available. So a lot of treatment, lot of research has happened over this, and there are certain hormonal treatments available now. There are certain targeted treatment against that particular gene available now. So this is how the treatment has now shifted to a more genetic and molecular level, and this needs to be done at a very initial stage itself. So when an initial biopsy is done, whenever there is a lump and patient is and which is suspicious of breast cancer, so the first thing the physician would ask is do a biopsy. So at that biopsy itself, all these markers should be tested, and hence the profiling of the cancer should be done, which will guide us through all type of treatment modalities available.
Okay. Well, coming to that, because the genes are involved, we've had quite a few famous cases of people doing screening and then removing both breasts, like just as because you're positive for the genes, so just take it out before anything bad happens. What are your thoughts on this kind of radical treatment?
Yeah. So the famous celebrity is the Jolie, and in fact we have been studying it as a Jolie effect, because when she came out with her part of story, so there was a sudden rise in the amount of test which was taken for BRCA1 and BRCA2. These are the two genes associated with breast cancer, BRCA1 and 2. So that was called the Jolie effect. But it's definitely not an over the counter kind of a test. Like you do your annual checkup, you get your blood test done. It is not a test like that. It has to be taken very seriously because it has implications. So if you think that you have a family history which is significant for breast or ovarian or gynecological cancers, then you should first meet a genetic counselor and know your risk, chart out your family tree, and whether you are actually falling into that high risk category. That is important. And if you are in that high risk category and you intend to take the test, it is to be done only after a proper counseling, that what you should expect from this test. So it's not a plus and minus kind of a positive or negative kind of a result. You might get a ambiguous result as well, or something like there is a mutation in the gene but we don't know what that mutation does. So just imagine yourself in a situation when you do a test and you land up with such kind of a result, that you know that you have a mutated gene but the science cannot give you an answer what is to be done about it. So these are all the scenarios which might happen. So these you should know before doing the test with a proper counseling. And also it has a lot of implications health wise as well as social implications which we yet don't know. For example, we have younger patients of age group 34, 35 who have been diagnosed with the gene positive kind of cancer, and they have daughters who are 17 or 16 year of age, and they want to know whether they should do a test for them or not. But at the same time, what if we do a test for an 18-year-old girl and she comes out to be positive? What are the implications on her socially, or what are the implications on her psychologically? All these factors are to be understood and deeply before taking all these kind of tests. So it's a pre-test counseling is a must, then the genetic test and the post-test counseling. It's a whole charade of things you need to do before taking this test. And if it comes out to be positive, so it does not imply that you will 100% have the breast cancer. So you are at a higher risk than other general population, but it's not that it's like a report card. If it is positive, then you will have breast cancer. So a lot of understanding there is required. And if at all it comes out to be positive, you can still choose on active surveillance. That is, you can do your high risk screening. So like for the general population, we have an annual mammogram, but for a high risk screening, there would be different tests, MRI, breast, and other tests that would be advised. And at the same time, there can be radical surgical options also there, which reduces the chance of you getting the breast cancer drastically, but obviously it has to be your cup of tea to take it, and it involves removal of both the breast and as well as both the ovaries. So this is what the celebrity did. So that's a very effective, as an oncologist I might say it's a very effective way, but then there are implications attached to it.
Correct. And that comes also with our, our duty as doctors to treat the patient as a whole, right? Not just
Right, right.
medically, but as you said, the social aspects, the family aspects, the mental aspects of the patient. So,
Exactly. So because this disease has a really heavy toll on the person, individual itself, as well as the family, and it's not a cross sectional dealing with the patient that I'm seeing the patient for this one time and then that's it. So usually our association with the patient is a long term association. So we have to look into all the factors.
correct, correct. Well, we have had to deal with COVID over the last 2 years, and it has, spread into every field of medicine. How do you think it has affected breast cancer diagnosis and just the treatment, follow-ups, stuff like that?
Yeah. So COVID has been unfortunate in many ways, but especially for cancer because uh, patients first of all didn't turn up for their follow-ups for their screening, so which had been really detrimental in finding early stage cancers because if the patients are not coming for the screening mammographies and ultrasound and regular checkups, so this has led to a reduced number of cases detected in early stage. At the same time, there were many patients which I came across uh, who noticed their lump in the beginning of the COVID time, like in March last year or something. But they didn't do anything because of the fear of COVID was so high that it was even higher than cancer. So so they kept the lump to themselves, and it became huge. It started to spread outside the skin as an ulcer or bleeding wound kind of a thing, or it spread to other organs. So this was a very common scenario which I was seeing during this time. So the amount of patients who could have been diagnosed earlier, they were reduced, and there were more advanced stages which we were seeing in this COVID times.
Right, right. That's indeed unfortunate. And, October being Breast Cancer Awareness Month, we can try and put the word out there as much as possible, bring awareness to patients and women out there to screen themselves and get tested and come and see, an oncologist or a professional if they feel that there's something wrong. That's what we hope.
Exactly. So, yeah, somebody was asking me why a whole month is dedicated for this disease itself. Otherwise, we have certain days for certain cancer, but this is a whole month. So, that is because we should understand that this problem is really big and really. It's important that we pay attention towards it, and more and more awareness as well as more and more screening at the same time. So that's the key to this
Correct.
problem.
Correct. Well, Doctor, it was indeed a pleasure to speak to you today, and we've learned so much, so much to think about as well. I really thank you for your time, and I hope to have you back here with us to discuss another topic sometime soon. Thank you so much.
It was an absolute pleasure because I really find great pleasure in spreading more and more awareness about this topic, and I would really want everybody who is seeing this to pledge to get themselves checked and encourage the family and female friends to do their checkups as well.
Thank you again.
Thank you so much.